afternoon, everyone. So, I don't know how you feel about this whole fight that we're in, but I just got to tell you, Medicare is not the problem. Medicare has been a solution for the last 50 years. And what are we fighting for? We're fighting to preserve it. And yes, healthcare costs are going up because, frankly, there are many more of us who are baby boomers that are going to rely on Medicare. But how about we take on those who are naysayers, those who want to privatize Medicare, those who want to repeal it, those who want to make it a voucher program. And let's get on with the business of bringing healthcare costs down, like our insurance commissioner Dave Jones is working on every single day. We have the greatest opportunity here in California to move ahead, to convince Congress in Washington that it's very cost effective to have health care for all, because we have health care for all and single payer, potentially in Medicare. So for all of you who are hitting the streets on this, and we're not going to give up the fight, and frankly Dolores Huerta has taught us all how to organize around this, I just say to you, happy birthday, Medicare, and frankly, we're going to be here and celebrate your 100th birthday, Medicare, and to say, we have got to get Medicare for all on the books. We've got to get single payer because, as your state controller, I will tell you, it is 3% of administrative costs for a health care program. That's pretty damn good. That's pretty damn good. Compared to 40% of administrative costs for private health insurance. So the fight ought to be about bringing health care costs down. Insurance companies, listen to Dave Jones. We don't want to be paying your 40% administrative costs. Pharmaceutical companies, we don't want you to keep jacking up drug prices so that people have to make a choice between drugs and food on the table. And expensive medical procedures that aren't going to do anything for us when we know what we have to do for our own bodies, our own lives, our families. So what I'm going to just say to you is, let's recommit on this 50th birthday of Medicare, but more importantly, let's continue the fight because we can get there. Medicare for all, single-payer health system, we're saving money. Medicare is not the problem. It's been a great solution for hundreds of millions of Americans. We got an election coming up in just a little over a year, and we're going to let everyone know who turns out, that the person we're going to put in the White House is going to fight for us. It's going to fight for us. And they're going to fight for us because they are going to stand up, and they're going to stand up to the pharmaceutical industry, stand up to the insurance companies, and stand up to those who are putting roadblocks in our way when we can't declare that health care is a human right. But we're all here because we know that. All of the civil rights struggles led by wonderful figures like Dolores Huerta. Recent struggles like healthcare for Healthy San Francisco, led by Tom Amiano. All of these were possible because we organized. And we're not going to stop this fight because not only is it about voting rights, it is about human rights at the end of the day. And we'll get it done right here in California. We'll show the rest of the nation. We will stand up to the insurance companies. We will stand up to the pharmaceutical companies. And let's get on with the business of expanding Medicare because this is the right thing to do. Thank you all very much.